And the evidence is so overwhelming, especially for cervical, where the majority of research has been. The WHO director, in his inaugural speech, when he was first elected director in 2018, created a worldwide goal, which is the elimination of cervical cancer. And what he said was, we have the tools to prevent, detect early, and cure this disease. I am calling for coordinated action globally to confine cervical cancer to the history book. And to do that, the WHO created an architecture, a strategy to eliminate cervical cancer. And what the strategy is 3 different pillars, where the targets are that 90% of all girls are fully vaccinated by age 15. 70% of women are screened with a high precision test at 35 and again at 45 years of age. And that for those women who are with some sort of a precancer or cancer lesion, that 90% receive treatment. Now, here in the United States, our goals are a little different because we have robust health system compared to a lot of poor countries. And so in the United States, we put the screening recommendation at 83%, and it isn't just twice in a lifetime. We want to make sure no woman develops cervical cancer. But if she is, if a precancer lesion is detected, we would like 100% of those women to receive treatment. We feel very strongly in the United States in support of the WHO elimination goal. And in fact, all 70 of the National Cancer Institute designated cancer centers, including the Moffitt Cancer Center, have endorsed the goal of eliminating not just cervical cancer, but all HPV-related cancers, which is possible through vaccination, screening, and treatment. So what do we need people to do? We need to advocate to protect ourselves and others from HPV cancers. We need to remind everyone that there is a safe and effective vaccine, that children and young adults ages 9 to 26 should receive the vaccine if they haven't yet. Only 2 doses are needed for children under 15 and 3 doses for those up to age 45. We need women to remember to continue screening. So the vaccine can prevent 90% of all infections that cause cervical dysplasia. But there are the 10% that it doesn't cover, and women need to continue to be screened even if they're vaccinated. But most adult women haven't had the benefit of vaccinations. So remember, we only started vaccinating 20 years ago, and it was a very slow uptake. We haven't reached everybody, and certainly not in the early years of the national program. So women remain unprotected because they haven't received vaccine. It's essential that they follow the national guidelines for cervical cancer screening. And what are those? We say it's the pap smear. It's really HPV testing or the pap smear every 3 years. And in the group of women ages 30 to 65, it's pap smear with HPV testing every 5 years. And with that, I thank you for your attention, and I hope you all go out and share the information with your friends and your family and your colleagues. I really believe the United States can achieve the elimination goal, the elimination of cervical cancer. We can do it if we all work together and share information. Thank you.